I'm the goofy EMT, call 911, you sure as hell ain't getting me, cuz I'm a transport.
Hello there my brethren and also ladies and gentlemen. I'm the Goofy EMT and this is the first video on this channel and I'm a teeny weeny bit nervous. But I'd love to give all newbie EMTs out there who have been in EMS for a teeny weeny bit while, or just those who are thinking about starting, some words of wisdom that I have learned and been taught by fellow EMTs and medics. The most important thing in EMS to me are my patients. My whole purpose of being an EMT is to provide the best possible care I can, be it in facilities, working IFTs, or running a code 1 on the streets. Because most of the time the new EMTs start with IFT, I'll give you some tips that will definitely help you provide the best possible patient care and learn what it means to be an EMT. Disclaimer. Working IFTs, you will definitely feel like you are just in Uberland. Sometimes even 911 will feel the same. Don't become lazy, because as soon as you let things slide, your patient care will soon start to get affected as well. Patient care reports. You have to fill out PCRs for every patient you have. In IFTs, inter-facility transfers, patients' information are in the patient charts, their past medical history and medications, and all of it summed up are in the discharge summary. Learn to read them thoroughly so you don't miss out any specific details about the patient. I have had instances where I myself have made the mistake of not thoroughly checking PCR only to find out later that there was a DNR/DNI order. Though it was in the patient's chart, a copy was not provided to me in the discharge summary. God forbid if the patient had coded during transport and I've had made attempts to resuscitate the patient, I would have been held liable. It is always best to ask the nurse for any peculiar details about the patient before the patient is transferred into your care. Nurses. Talking about nurses, I've had done this many times where I landed in a facility, my partner went to get the chart, and I just walked into the patient's room blindfolded. My mistake, I did not know what I was walking into. Patients would at times be on contact for precautions and the sign of it would be on the door and I missed it, or the sign would be on the floor, or there would be no sign at all. Or sometimes the patient would be aggressive and I would have no clue. All of these scenarios are very much real and are important to patient care. Before you get to the patient, get a verbal report from the nurse and read the chart to get an idea of what you're walking into. Medications. Talking about charts, my favorite part about charts are medication sections. You learn so much reading them. Once you interact and care for multiple patients, you will see many of the patients have similar medications and similar past medical histories. This not only helps you learn pharmacology, which will make you a better EMT of course, it will also help you prepare for paramedic school. Not only that, when an emergency comes and the patient is unable to tell you their past medical history, learn to read their medications, which will give you a conclusive hypothesis and lead your assessment in the right direction. Narratives. Guys, narratives are the most important thing for me in my PCR. It details out what I did as an EMT for my patient from start to finish. I don't leave anything out, not even the slightest of details, because it'll cover my butt 10 years later in the court. How I write my narratives, I go in chronological order. My unit dispatched to a XYZ location for patient. If 911, add chief complaint. If IFT, add the reason for admitting diagnosis and why the patient was there. Then what I saw upon arrival, how the patient looked, what the patient was doing, was the patient being provided a treatment, does the patient have any attachments on them, i.e. suprapubic catheters, colostomy bags, any facial or body damage, anything to note, I note down. This sharpens my eye on quick assessments and is the first stepping stone to my further assessments. After doing all that, I go into my assessments, which include ABCs, ANOs, skin CTT, vitals. Yes, vitals. Guys, in facilities, especially those working IFTs, you have to take the first set of vitals manually. This will only help you get accustomed to taking BPs regularly and more accurately, and also because I don't trust machines. Because as EMTs, we really don't do much in terms of treatment-wise, but whatever much we do, vitals and making sure patient's O2 is on, please also check if the O2 is on and at the right LPM to make sure the patient's comfortable throughout the transport. Let's do it to the best of our abilities. We are EMS. What we do matters. Till next time, guys. Hope this video was helpful, and if you'd like me to cover any additional topics, leave it in the comments below and I will do my best to provide the details out. If I can't, I know many experienced EMTs and medics in my contact list and I'll get you the information you need. Until farewell, Alvida.